Mesothelioma is an aggressive form of cancer that develops in the mesothelium, the protective lining that covers many of the body's internal organs. The most commonly diagnosed type is pleural mesothelioma, which occurs in the pleura, the lining of the lungs and chest cavity. Diagnosing mesothelioma can sometimes be challenging as its symptoms are typically vague and can mimic other conditions. While a biopsy followed by histological examination under a microscope is usually required to confirm a mesothelioma diagnosis, there are some alternative diagnostic approaches that can provide supplementary information. Imaging techniques. Various imaging modalities such as chest X-rays, CT scans, MRI, and PET scans are often the first tests ordered by doctors when mesothelioma is suspected. Chest X-rays may reveal pleural plaques or thickening of the pleura. CT scans provide more detailed images and are better for detecting small tumors, pleural effusions, excess fluid, and whether the disease has spread beyond the chest. MRI can more clearly define the local extent of tumors near the diaphragm or chest wall. PET scans use radioactive tracer glucose to detect where cancer cells are actively dividing. Mesothelioma tumors typically appear as areas of high radiotracer uptake. While imaging cannot definitively diagnose mesothelioma, it allows doctors to detect abnormalities and guide biopsy sampling. Serological tests. Blood tests for certain serum markers have shown potential as supplementary diagnostic tools for mesothelioma. Soluble mesothelin and related peptides, SMRP, and megakaryocyte potentiating factor, MPF, are two proteins that tend to be elevated in patients with mesothelioma compared to healthy individuals or those with other lung diseases. However, neither marker is specific enough on its own and both can be normal in some mesothelioma cases. Combining SMRP or MPF levels with clinical findings and imaging may help support a presumptive diagnosis before biopsy. Ongoing research is evaluating whether certain microRNAs detectable in blood could serve as novel biomarkers. Thoracoscopy. This minimally invasive surgical procedure involves inserting a thin, lighted tube, thoracoscope, through small incisions in the chest wall to examine the pleural surfaces, collect pleural fluid samples, and obtain targeted biopsies of any suspicious areas under direct visual guidance. Thoracoscopy allows comprehensive visualization and sampling of the entire pleural space with less postoperative pain and faster recovery compared to larger surgeries. Findings on thoracoscopy such as pleural thickening, nodules, or plaques raise suspicion for mesothelioma. Post-surgical pathological analysis. Even after a suspicious mass is removed during thoracoscopy or open surgery, determining the specific histological type of mesothelioma requires microscopic examination of biopsy specimens by a pathologist. The three main types, epithelioid, sarcomatoid, and biphasic, mixtures of the other two have distinguishing features at the cellular level. Immunohistochemistry, IHC, which visualizes tumor markers using colored antibody markers, helps differentiate mesothelioma from lung adenocarcinoma or metastatic cancers. Electron microscopy can also detect characteristic particles, for example asbestos bodies, in some mesothelioma cases related to prior asbestos exposure. Molecular testing. In difficult-to-diagnose cases, new molecular techniques may assist pathologists. Fluorescence in situ hybridization, FISH, probes for common gene deletions in mesothelioma cells, such as 9p21 homozygous deletions, can provide supportive evidence. Polymerase chain reaction, PCR, assays detect characteristic gene fusions or mutations that occur in some mesothelioma subtypes. Whole exome sequencing analyzes all protein coding regions of DNA for any characteristic mutations. As molecular markers are identified that reliably distinguish mesothelioma from mimics, targeted genomic panels may become standard practice to supplement histopathological analysis. Mesothelioma diagnoses remain challenging because the disease presentations can vary significantly and overlap with other conditions. While a malignant tissue biopsy analyzed microscopically by a pathologist remains the gold standard, integrating clinical imaging findings with serum markers, Minimally invasive visual examinations of the pleura through thoracoscopy and emerging molecular techniques help strengthen diagnostic confidence, especially for atypical cases that initially present diagnostic uncertainty. A multidisciplinary approach leveraging all available tools improves accuracy and ensures patients receive proper subtyping and staging to determine the most appropriate treatment plan.